Hey everybody, today I wanted to talk about some exciting new research that's being done at the Feinstein Institute. This research is looking at the effect of vagus nerve stimulation on the treatment of lupus. So they did an initial pilot study and now they've actually gotten grant money to continue their research. So I'm going to tell you the details about the pilot study first. So in this study, they had 18 patients who had a diagnosis of lupus and who had pain greater than a 4 out of 10 on a 10-point scale in their musculoskeletal system. This was a double-blind randomized control trial. And what they did is they divided the patients into two groups, one that got the true vagus nerve stimulation and one that got the sham stimulation. And they did auricular vagus nerve stimulation, so at the ear, for 4 days, and took measurements at baseline, day 5, and day 12. And what they measured was pain, disease activity, and fatigue. And then they did something called the Physician's Global Assessment, which is an assessment that looks at a number of different markers, a number of different components that help the physician determine disease severity and how somebody is responding to treatment. And the doctors were blinded to what treatment the patients had gotten, whether they gotten the true vagus nerve stimulation or the sham stimulation, which is why it's considered double blind. The patients didn't know and the doctors didn't know. And what they found at the end was that the group that had the true vagus nerve stimulation had improvements in pain, had improvements in their disease activity, improvements in their fatigue, and their scores on that physician global assessment were better than the group that got the sham stimulation. In addition, the group that had the true vagus nerve stimulation also had lower levels of substance P. Substance P is something that promotes neuroinflammation and is a key player in the disease pathology of lupus. So after the results of this study, the Feinstein Institute, the physicians there that were doing this research were awarded a $450,000 grant to continue this research. And the Feinstein Institute is one that's doing a lot of research on vagus nerve stimulation, and it's really exciting, the stuff that they're looking into. So this is really cool that they're checking this out. And right now they're looking at transcutaneously. Feinstein Institute also looks at the surgically implanted devices for different conditions as well. So awesome research. Glad to be sharing that with you. If you haven't been here before, I'm Carissa Conrad, Doctor of Physical Therapy and Therapeutic Pain Specialist, and I am the Vagus Nerve PT, and we'll see you soon.